Many patients come in and they ask us about needing a root canal. Maybe they've been told by another dentist they need a root canal, or they're just wondering if their tooth might need to have that procedure done. When you hear the term root canal, it kind of conjures up scary thoughts of long procedures that are very painful and lots of discomfort. That's really, I think, a picture of the past, because the current picture, the modern picture of root canals that we would give you is much different. Many of our patients, when we get done with a root canal, tell us, gosh, that was almost like having a filling done. It was very easy. And that's because most root canals that we do nowadays can be done in one procedure, one visit, which is very nice. We can use really good anesthesia so a patient is very comfortable. And the procedure itself is actually very straightforward. Imagine your tooth is like a candle with a wick in it. A root canal is like taking the wick out of the candle, drying that area and sealing it. You still have the candle, it's just now sealed. Same with your tooth. So it can be a very effective procedure, allowing us to save a tooth. In many cases, if we couldn't do the root canal, a tooth has to be extracted, and that could lead to the need for a surgery, an additional surgery, for example, of getting an implant put in, or major restorative dentistry to fix that area so that a person doesn't have what we call bite collapse, where their teeth start to shift because of a missing tooth. By keeping a tooth, we give them much better options for the future. Typically, a tooth that has a root canal, all we have to do is put a crown over that tooth and you can chew on it again. So it allows us to give you a really positive result quickly, maybe in a 1-hour appointment or less, and keep your tooth. Studies show that a properly done root canal, with all the steps done properly, and a properly placed implant lasts the same amount of time. So if we know we have the option to give a patient a better choice, keeping their own teeth, doing it in a simpler procedure that costs less, we want to make sure we give those options to all of our patients. Our goal is to always give patients care that benefits them and will give them a smile and function that will last for many, many years to come.